Okay, the differentiation between heart attack and cardiac arrest. Now, a lot of people, almost all of them, don't know that there is a difference between these two. People think कि अगर हार्ट का प्रॉब्लम है तो हार्ट अटैक ही हो सकता है अगर किसी को हॉस्पिटल लेके जाया गया है या somebody is complaining of the heart, it could be symptoms of a heart attack. But that is not true. And we want to tell you the difference also because the way to help each is different. Okay? तो मैं heart attack से शुरुआत करता हूँ. So what is our heart? Our heart is a muscle, or rather, it's a muscled organ. Okay, and the primary function of the heart is to supply blood all over the body and to itself as well. Okay, now how does the blood flow to the body and to itself? Via arteries. You know about this, right? Those are known as coronary arteries. Now the problem starts happening in these arteries, and the name of the problem is blockages. Okay, you must have heard this term from the doctors sometime or the other. Now, blockages, what do these blockages, what problems do these blockages cause? They stop the supply of blood. So the bigger the blockage, the more the supply of blood is stopped. And if the person has not taken any medication, then the blockages keep growing over time. And at a certain point of time, they have grown so big that they're blocking the entire supply of blood, which is known as 100% blockage. अगर ऐसा हो जाता है तो ब्लड फिर कहीं पर भी पास नहीं होता, पूरे बॉडी में तो जाता ही नहीं है लेकिन दिल में भी नहीं जाता है. उसकी वजह से जो हार्ट के मसल्स और टिश्यूज होते हैं वो बहुत बुरी तरीके से डैमेज हो जाते हैं एंड दे डाई, एंड दिस इज नोन एज हार्ट अटैक. Okay, so let me tell you the symptoms of heart attack so that you understand. If you see it happening in a person, you'll at least know what's happening to that person. Okay, so let's take an assumption you're on the road and somebody is right in front of you and he's going through this. So what are you going to observe? The first thing that you're going to observe is that the person is going to complain of chest pain. He's going to have a massive chest pain right in the middle of the chest. Okay, you're going to observe that he'll be perspiring. बहुत पसीना हो रहा होगा उसके फेस पे. You're going to see, you're going to observe maybe back pain or left shoulder pain or maybe jaw clamping, right? And you're going to see that he's become very weak. So if he's walking, he's just going to sit there. He will not be able to walk anymore. And you're going to observe that he'll have a very difficult time breathing, difficult to breathe. सांस लेने में तकलीफ. So these are the symptoms of a heart attack, right? Now, if you ever happen to come across a situation like this, where you see a person going through exactly what I just told you, please rush that person to the hospital immediately. Okay? Now, a lot of people don't do that. Why? Because, and quite innocently so, because they don't understand that this is the problem for heart attack. They think maybe this is a gas problem. Maybe this is an indigestion problem. So they say, okay, you sit for 5 minutes, I'll get you some water, put Eno in water, and you'll be okay. But you please don't do that. Don't take any risk. Rush that person to the hospital immediately. Okay? चलिए cardiac arrest पे आते हैं. See, cardiac arrest is totally different to a heart attack, even in terms of how it happens. So blocked arteries, etc. उससे कुछ भी लेना देना नहीं होता है. Okay? तो क्या होता है समझ लेते हैं. देखिए, एक अडल्ट का दिल, यानी कि आपका दिल, मेरा दिल, हमारा दिल एक सर्टेन रिदम से बीट करता है. Okay? What is that rhythm? The rhythm is between 60 beats per minute to 100 beats per minute. So beep, 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 beep. This is the rhythm that our heart beats in between 60 beats per minute to 100 beats per minute. Okay? Now, अगर इस इंसान का एक्सीडेंट हो जाता है या फिर इसका इलेक्ट्रिक्यूशन हो गया या फिर इज ड्राउंड फॉर अ लॉन्ग टाइम, somebody has got him out of the water, तो क्या होता है, ये जो मैंने आपको रिदम बताया, it goes completely haywire, completely chaotic. Okay, so while our heart should have been beating like this, beep, 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 now it goes like this. You see, this is literally how it happens. Okay, Dr. Akshay is with us. He's going to explain more on that. So, ऐसा होता है. This is known as fibrillation. So the heart is fibrillating, and therefore the heart itself doesn't know what to do, and therefore it stops. And this is known as cardiac arrest. Okay, and cardiac arrest happens suddenly. Therefore, it's known as sudden cardiac arrest. Remember, heart attack is not known as sudden heart attack because heart attack has early warning signs, but cardiac arrest does not. Okay. चलिए नाउ लेट मी टेल यू द सिम्टम्स. आप क्या देखोगे अगर किसी इंसान को कार्डियक अरेस्ट हो जाता है, ठीक है? So let's again take the same assumption. You're on the road and somebody is in front of you and he's just got a cardiac arrest. So what are you going to observe in that person so that you understand what's happening to him? The person is immediately going to collapse on the ground. He's going to become unconscious and he'll collapse immediately. और आपके सामने ही गिरा है तो obviously you're going to be a bit concerned. You're going to think, I don't know what happened to this person. You know, it's you're going to say, hello sir, are you okay? Hello. आप करोगे, you're going to ऐसा कुछ आप हिलाओगे उनको, hello sir, sir, are you okay? You're not going to get any response out of him. Okay? उसके बाद आप सोचोगे चलो मैं इनकी सांस चेक कर लेता हूँ. तो आप सांस चेक करोगे. कैसे चेक करते हैं सांस को? Finger under the nose. So you're going to check the breathing of that person. If you do that, you're not going to feel any breath on your finger because he's not going to be breathing. Then you might think, चलो ठीक है, let me check the pulse of that person. तो आप pulse check करोगे. This way maybe, और this way maybe. आपने डॉक्टर्स को करते हुए देखा होगा. आप अगर ये चेक करते हो तो आपको पल्स भी नहीं मिलने वाली है. And that time, trust me, you're going to panic because आपके सामने क्या दिख रहा है आपको? The person has collapsed. He's unconscious. No response. No breathing, and there is no pulse. तो आपका logical conclusion क्या होने वाला है? What are you going to think? You're going to probably think that the person is now gone. The person is dead. That is what you're going to think. Correct? I hope you are agreeing to me. Now, I want you to know that if you ever happen to come across a situation like this, in the similar way that I just told you, do not make the mistake of thinking that the person is dead, because that is not going to be true. The fact is going to be that the person is very much alive, but he's gone into a sudden cardiac arrest situation. And the second truth is going to be that he requires your immediate help. हार्ट अटैक में तो बेचारा फिर भी बोल सकता है कि मेरी मदद करो because he's still breathing. In cardiac arrest, he stopped breathing, he's unconscious. You'll have to understand what he's going through and help that person. Okay. Now, we haven't told you how you're going to help, so we're going to come to that. लेकिन इससे पहले कि हम वो आपको बताएं, I want you to know one more thing. Now remember, in the earlier slide, I had told you that you need to help that person within 3 minutes of time, even though you may have called the ambulance. I hope you remember that. Now, let me give you a logical explanation of why I said that. Okay. Now, our body has one very sensitive organ called the brain. Now, for the brain to function fully, it requires a continuous supply of blood and oxygen. Okay, remember, oxygen goes with the blood. Okay, that's why it's known as oxygenated blood. So, if the person goes through a cardiac arrest situation, the heart has stopped. The blood is now not going anywhere in the body. It's not even going to the brain. Now, if the brain doesn't get a continuous supply of blood for 3 minutes, the brain goes into a damaged condition and the person is going to go into coma. Okay, and in 10 minutes, the person is going to be no more. And that's the reason it's very vitally important. You immediately, the moment you've recognized, you have to immediately jump into action, not think too much, and start helping that person. Okay, but how are you going to help? So I have told you what the problem is. Now we're going to tell you what the solution is, how you can help that person before the ambulance arrives within 3 minutes of time, so that not only his brain is okay, but his life is also okay. He doesn't die. Okay, so 4 very simple steps. Keep writing those things down. And at the end of the session, you can ask us a lot of questions. I can see you've already started asking. Very good. All right. Sumaya?
So till now we have understood that a heart attack and a cardiac arrest are two different things. In a heart attack, a person is telling you he is not feeling well. छाती में दर्द हो रहा है, आप उसको hospital ले जा रहे हो. But in a cardiac arrest, person has collapsed in front of you. He is not breathing. He is not responding. And how you help him at the earliest is what we're going to learn in the next 4 steps. So coming to our first step, as I said in the beginning of the session, is to recognize that the person collapsed in front of you has collapsed due to a cardiac arrest or due to some other reason. So how are we going to find out that? So assume somebody has collapsed in front of you, either sitting down or sideways, as you saw in the video. The first thing you need to do is put this person on the floor. Zameen pe usko letana hai. So put this person on the floor and then check whether he's responding by tapping both his shoulders. So you will tap both his shoulders like this and ask, hello, are you okay? Kya aap theek ho? So you can see Anand and me like this. Hello, are you okay? Here, you do not have to give him love and affection. You have to hit him a little hard, shout a little loudly. Both the ways you're checking if he's responding. So, hello, kya aap theek ho? Are you okay? No response. That means you know this person is unconscious. Ye behosh hai. Now you have to check whether he is breathing. So, जैसे आनंद ने आपको बताया, many different ways of checking if a person is breathing. You can put the finger under the nose. You can check the artery. You can check the pulse. All these ways are not wrong. They are correct. But we are going to teach you the fastest way of checking if somebody is breathing, and that is by putting your hand on the abdomen. So if the person is lying down like this, you'll keep your hand here on the abdomen and you'll press it for 10 seconds and check whether there is a movement, if there is a breathing. Remember, you do not have to keep your hand on the chest area. You have to keep your hand on the abdomen, press it a bit and check if there is a movement. Now, if there is a movement, that means you know this person is breathing. Take him to the hospital. He has collapsed due to some other reason. So अगर सांसें चल रही है, मतलब आदमी और कोई वजह से गिर गया है, उसको हॉस्पिटल ले जाओ. But if there's no response and there's no breathing, that means you have recognized that this person has collapsed due to a sudden cardiac arrest. तो होश नहीं है, सांसें भी बंद है, तो ये आदमी कार्डियक अरेस्ट की वजह से गिरा है. So our first step is no response, no breathing. We have identified a sudden cardiac arrest. But if you see person is not responding and not breathing, don't think, oh my God, this person is gone. He's in a sudden cardiac arrest situation. He has 10-15 minutes of time and you have to help him. So no response, no breathing. You have identified a sudden cardiac arrest. मैं हिंदी में भी बोल देती हूँ, होश नहीं है, सांसें भी बंद है, हमने cardiac arrest पहचान लिया. This is our first step. Vilma, can we have the slide, please? So जैसे आप देख रहे हो slide पे, person is made to lie down. You're tapping his shoulders, no response. Check for breathing, no breathing. No response, no breathing. You have recognized a cardiac arrest. Now we are going to step number 2. Second step, you're going to call for medical help. You are not a doctor, and even if you are a doctor, I can see there are many doctors in this group. अगर आप doctor हो भी, तो remember this collapse is not happened in the hospital. It is out of hospital collapse, either in the house, on the road, on a street, in a mall, or at the railway station. So you do need medical help. You do need an ambulance. So make sure today only you save in your phone emergency numbers. That is hospital numbers around you, around wherever you're staying and around wherever your railway office is. Make sure both the places ambulance numbers are saved in your phone. Remember, an emergency can happen anywhere, anytime. At that point, you'll think, I wish I had saved emergency numbers in my phone. Today, my time also would be saved. So make sure you save emergency numbers in your phone today. Also save the number 108. This is a government service number which you can dial directly from your phone. So make sure you save hospital numbers and 108 both in your phone, so that in case one number you cannot connect, you have another number on hand. Now, when you call for an ambulance, remember you need to ask for a cardiac ambulance. At the time somebody is collapsed, it's a lot of panic, chaos situation. People are screaming. So you may just call up and say, please send me an ambulance. Jaldi se ambulance bhejo. That time a small ambulance with a ward boy and a stretcher will come. But in this situation, you have to ask for a cardiac ambulance, because every cardiac ambulance has a doctor as well as this machine. So make sure in your second step, when you call for an ambulance, you ask for a cardiac ambulance. And also, if you know this machine is somewhere around you, as I said, you will find it in many malls, at every airport, there's this machine. So if you know this machine is somewhere around you, ask somebody to get the close by AED machine. So second step, you're going to call for a cardiac ambulance and the AED machine if you know it is somewhere around you. Anand, you want to add something, or should we go to the next
Yeah,
step?
just one thing, Sumaya, about 108. So, in case the people here are not aware that whether 108 is available or operational in your area or in your state, it is. Telangana is one state it is operational in. I would like you to know that 108 is operational in 18 states of the country, including yours. So 108 is a number that you need to feed in your phone immediately, okay? Or rather after the session. Okay, so ma'am, go on.
So we've completed our 2 steps. We have recognized a cardiac arrest and we've called for medical help. Now we are going to step number 3. Step number 3, we're going to learn how to do CPR or cardiac massage. So first of all, I'm going to show you where you need to do this on the body. So if you can see the mannequin, think of an imaginary cross. The point between the two nipples here, the center point. This
Irma,
is the
can we have
point.
the slide off, please? Sorry. Yeah.
Okay, so if you think of an imaginary cross on the body, the point between the two nipples here, the center point, this is the place where you will be doing cardiac massage or chest compression. So if you feel your body from the top, there's a hard sternum and then there's a soft portion that goes in here. So exactly the point between the two nipples is here where you will be doing cardiac massage. Now remember, this point remains the same. If it is a man or it is a woman, the point remains the same here between the two nipples. So दो nipple के बीच में जो center point है. Now we are going to show you hand positions. So I know आपके videos on नहीं है, लेकिन अगर आप ये हमारे साथ करें, if you do this with us, you will have an idea how hand positions will be. So it doesn't matter if your videos are not on, but please do this with us. Put your dominant hand straight, extremely straight. Your elbow has to be straight. Your hand has to be stretched out. Open up your fingers and interlock it from the top with the other hand. So remember, your hand has to be like this, both elbows straight, hands completely stretched out. Those who are in groups also, please do this. Those who are attending this individually on their phone also, please do this so that you understand how your hand positions are. So your hand has to be completely straight in this position. Okay. This is called the heel of the palm. This heel of the palm will come in this center point, the point between the two nipples here, like this. And how to do compressions, we're just going to show you a small video, after which we are going to explain it to you in even more detail. So as you can see on the slide, person is made to lie down, heel of the palm, center of the chest, and he is ready to do compressions. Hands are interlocked just like how we showed you. And now this needs to be done either from the left hand side or the right hand side of the person, not from the head side, not from the leg side. So he's taken his position. Let's watch how he's doing CPR.
Practice. First, get into position. Place the heel of one hand on the center of the chest. Put the heel of your other hand on top of the first. Follow along with the drum beat. Let's begin. Push straight down, hard. Push down at least 2 inches. Push at the rate of 100 to 120 compressions per minute. After each compression, let the chest come back up to its normal position. Keep your compressions going until the drum beat stops.
So as you can see how he's doing the compression, heel of the palm, center of the chest, and he started doing the compressions. He's doing this hard and fast. His elbows are straight, pressure coming from the shoulders. You need to do just this same way in case of an emergency. So just how we saw in the video, heel of the palm, center of the chest, and he started doing the compressions. Now these compressions need to be done at the rate of 100 to 120 beats per minute, going down 5 centimeters and recoiling. This is the rhythm, 100 to 120 beats. But why this rhythm like that? Because our heart is also pumping like this. 1, 2, 3, 4. With the same rhythm, you have to do the compressions. 1, 2, 3, 4. So exactly what are we doing? His heart has stopped. And because the heart has stopped, blood is not reaching the different parts of the body and the brain. If the blood doesn't reach the brain in 3 minutes, person goes into a coma. 10 minutes, he's gone. We do not want this to happen. So the heel of the palm becomes his heart. The moment you keep the hand in the center of the chest, you compress down and you recoil. That is, you allow the chest to rise. Every time you do that, blood from his heart is pushed to his brain. See how important this is. हर बार आप compress करके छोड़ते हो, compress करके छोड़ते हो, खून उसके दिल से उसके brain तक पहुंचता है ताकि आदमी जिंदा रहे. But doing this, it is not easy. It is very difficult. However fit you are, once you start doing the compressions, you will tire out. And if you're tired, you will not be doing effective compressions. So what to do in a situation like this? Compression, so you have to do, otherwise how is the person going to revive? So one thing is good in our country, if somebody collapses, you have 10-15 people around you. They'll give you free advice. You know, juta sungao, put the chappal, put water on his face. Just give me a second, please. You have to say, no, I know what I'm doing. You continue to do it and tell everybody around you, see how I'm doing. The moment you feel slightly tired, you tell the person in front of you, now you take a turn and do this. You take a turn and do this. Let people do this turn by turn so that effective compressions are done. And while the other person is doing, you see whether he's doing it correctly, he's doing it in the center of the chest. And you can also call the ambulance. But turn by turn, it's necessary that you do it compression so that they are effective. But till when you have to do this turn by turn? You have to continue doing this turn by turn till one, he revives. That is, he opens his eyes, he starts breathing. You will stop your compressions. Two, if your cardiac ambulance comes, you will give him to the doctor. Doctor, aap dekho, and you will stop your compressions. Or thirdly, if somebody brings this machine and gives it to you, to attach the pads, you will stop the compression. Otherwise, you're going to continue compressions even if the ambulance takes half an hour or 45 minutes or 1 hour to come. Doctors have done this compression even for an hour and a half and saved somebody. So you are nobody to decide, how much time should I do it. You have to continue doing it till he revives or till your cardiac ambulance comes. So in your second step, where in the center of the chest, you have to do the compressions at the rate of 100 to 120 beats per minute, going down 5 centimeters and recoiling, doing this turn by turn till he revives or till your cardiac ambulance comes. Yes, Anand.
Okay, before I continue, Dr. Akshay, are you there? If you're listening to me, okay, doctor, if you would, there are a lot of questions already coming in. If you would like to answer those questions directly in the chat box while we are doing our presentation, it would be, if you want to do that, you can do that.
Yeah, sure. You want to read or I should read?
Doctor, I can't hear you.
No, doctor, we're not answering the questions verbally right now. If you want to type it in the chat box or at the end of the session, we'll read it out to you and let you answer.
Read on the chat box, but
okay.
I can answer now or later. You tell
No,
me.
You can type,
do it
you
at
can
the
type
end.
the answers. Or you
Either
can type the answers.
it, or we do it at the end of the session.
Okay, okay, thank you.
Yeah, I'll just answer one question since it's related here. Bala says, please advise very few the heart, the other side, what to do. Okay, so the compressions, as you saw, has to be done either from the left hand side or the right hand side of the person, not from the head side, not from the leg side. So when you do the compression, you will either be on the left hand side of the person or the right hand side of the person and continue compressions. Yeah, continue.
I think he meant if the heart is on the right hand side. Very few got the heart on the right.
Then we'll answer that later.
We'll
Doctor will answer
later.
that later.
Okay.
Yes.
All right, chalo, I'll continue. So there is a possibility, I'm assuming that some of you might have seen the demo of CPR being done for the first time in your life, or exactly how to do it, right? Now, to see it on a computer and to do it in real life are two very different things. Okay, so when it happens in real life, there is a possibility that you might hesitate. If it actually happens in front of you, you might hesitate. You don't know whether, whether you should go about doing it, how you need to do it, etc. That time, it's a difficult time. So you don't hesitate. I want to give you two very strong reasons. So imagine the scenario: you're on the street, okay, aap sadak pe ho, and the victim is lying right in front of you. You know he's got a sudden cardiac arrest, and you have to perform CPR on that person. But there are 50 people looking at you, and you're kind of hesitating. So you don't hesitate. Here are two very strong reasons. Strong reason number one: that point of time, you cannot give that person water to drink. Don't do that. That is a no. Okay. That point of time, you cannot give any food item for him to eat, like put some food into his mouth. You can't do that. The person is unconscious. Okay. You cannot give any medicine to that person at that point of time. And because you're not a doctor, you won't be able to inject any medicine into him. And even if you happen to be a doctor, you may not have your, those tools where you can do anything about it. So what is the option left for you to do? There's only one option left: perform CPR on that person. So without hesitation, without thinking too much, start performing CPR on that person to save his life. Okay. The second strong reason is that CPR is not difficult to do. If you think, I don't know whether I'll be able to do it, I just saw it on the computer, but in real life, I don't know. I am telling you this, that you will be able to. I have more confidence in you than you have in yourself. And do you know the reason why? The reason is we have seen people do it who had, who have had no, okay. There is no connection that they have had with the medical line, and they were still able to do it just because they were able to see this session and they have seen it on YouTube, etc., and they actually revived people. So if they can do it, why can't you do it? Right? So don't, at that point of time, don't hesitate to do it. Okay. Let me tell you two or three odd other things about CPR. So CPR is cardiopulmonary resuscitation. Cardio means cardiovascular. आपके दिल की बात है. Okay. Pulmonary means something to do with the lungs, and resuscitation means revival. So you're trying to revive a person. That's why it's called CPR. Now, any single time that we've seen CPR being done on television, or we've seen it being done in the movies, or we've read somewhere about it, we've always observed that along with CPR, they give mouth to mouth. You know, the मुंह से सांस देने वाला process जिसको बोलते हैं, they always do that. But I want you to know this: you don't have to do it. Don't do it. Okay, don't have, there is no requirement for you to give mouth to mouth to that person. Okay, if the person has fallen right in front of you and it's a normal circumstances, is on the road, just do the hands only thing that we've showed you, and that is going to be quite enough. Having said that, I don't mean that mouth to mouth is never done. It's done, but when the circumstances are different. For example, water body is involved, or the person is asthmatic, or it's a drug overdose, etc. But under normal circumstances, you don't have to do it. Okay, that will be like a misuse of time. And the last thing that I want to say is, I don't really want to explain the last thing. If you have a pen and a paper handy, just write this down. I'm going to tell you a line to write down. I'll say it in English, and then I'll say it in Hindi also. Okay. The last line is this. Are you ready? CPR is not performed on a person who is breathing. Please write this down. CPR is not performed on a person who is breathing. In Hindi, CPR उन पर नहीं करते हैं जो सांस ले रहे होते हैं. CPR उन पर नहीं करते जो सांस ले रहे होते हैं. Which means, for whatever reason a person may have collapsed, don't start performing CPR on that person. Okay, including in the case of a heart attack. So even if the person is having a heart attack, you don't have to perform CPR on that person. Why? Because the person is breathing. And the no breathing part happens only in one condition, which is sudden cardiac arrest. So if you have recognized that it is a sudden cardiac arrest, then you go ahead and immediately start doing it. Okay. All right.
So we've completed our 3 steps. We've recognized the cardiac arrest. We've called a cardiac ambulance, and we've done hands only CPR in the center of the chest. Now we are going to go to our 4th step, where we're going to learn how to use the AED machine. So the full form is automated external defibrillator. In lay language, it's called a shock machine. In case you've seen this machine in any other shape or color, please do not worry. There are different manufacturers that by different shape and color, but they all work the same way. So if you can see, this machine looks like this from inside. There is a pull lever. The moment you pull open the lever, it's going to tell you what to do step by step. So I'm going to do that. Now I'm going to switch it off to explain to you, but in case you ever use this machine, you will keep it on at all times. So the moment you open the machine, you can see there's a set of sticky pads. There are 2 pads. Each pad has got a picture with an arrow indication where this needs to be attached on the body. This one says here on the right hand side below the collarbone, and this one says here on the left hand side below the ribs. So just like how it is given in the picture, we are going to attach it onto the person and show it to you. So just like how it is given in the picture, attach the pads, and you also need to attach the pads the same way. Remember, our heart is here. So when the shock is given, it should go through the heart. If you've attached the pads like this or like this, it is not going to go to the heart. That is why the picture is given, and attach the pads as per the picture given. Now, another important thing is these pads need to be attached on dry and bare skin. That means if it is raining or the person is perspiring a lot or is taken out from a water body, just wipe that portion and attach the pads so that they stick properly. Bare skin is also important. If the person is wearing clothing, then if you attach the pads, it's not going to give a shock. Now, for bare clothing, a little problem is there. If a person collapses in the middle of the road or in a mall or in a public place where there are so many people, if it's a man, you'll just put up the shirt, open the shirt and attach the pads. But the same thing can happen to a lady. And if the pads if you go and try to remove the clothing of the lady, what will the public say? What are you doing? Why are you removing the clothing? Are you a doctor? So we have a small solution. If the lady is wearing a sari, you can adjust the blouse and attach the pads. But if the lady is wearing a full suit and it is tight, inside this box there is a pair of scissors. All that you need to do is take out this pair of scissors, cut open this portion of the clothing and attach the pads, so that modesty will also remain and you will go ahead and save the life also of the person. So we've attached the pads over dry and bare skin. Now let's listen to what the machine is saying.
Place pad. No one should touch the patient. Analyzing.
It's analyzing the heart rhythm of the person who is collapsed.
No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now.
See this
Deliver
button?
shock now.
This button is flashing. It's telling you to press the button
Press
to give
the
shock.
flashing orange button now.
So I'm going to press the button.
Shock delivered. Be sure the ambulance service has been called. It is safe to touch the patient. Start CPR.
So what did the machine do? The moment you attach the pads, first of all, the machine analyzes the heart. Once the machine analyzes the heart, the machine will decide whether the shock is required or not. You are not going to decide that. If the machine feels that the shock is not required, machine itself will say shock not required. But if the machine feels that the shock is required, there was a button that was flashing. Did you see that button? All that you need to do is press that button to deliver shock. But when you press that button, you should not touch the person, because if you're touching the person, you will also get a shock. That is why you do not touch the person, only press the button. Once you press the button, the person will get a bit of a shock like this. After that, the machine says, now it is safe to touch the patient. Start CPR. So you will not remove the pads, you will not switch off the machine, you will continue to do CPR in the center of the chest, because the machine has asked you to do. For 2 minutes, the machine is quiet, it allows you to do CPR. After that, it goes into the second cycle. Again, it analyzes the heart and decides whether second shock is required, because not necessary in one shock, his heart may start pumping. He may require 2, 3, 5, 10 shocks. But how many shocks to be given? The machine only will decide that. All you need to do is listen to the prompts, follow the prompts, and do what the machine is saying. Remember, this machine is for your use, not for doctor use. So if you have the machine in front of you, please do not be afraid. Go ahead, use that machine. You can also save a life. Yeah, Anand.
So I'm gonna tell you the same thing about AD, what I told you about CPR. If you ever get an opportunity to use this machine, please do not hesitate. Okay, for the very simple reason that this machine is made for the common people of the country to use. This is not a machine made for the use of a doctor, right? Now, if you think right now, maybe I am assuming that you're thinking right now, I don't know, I've never seen this machine, I don't know where to get it. So let me tell you that you are not going to get this machine in your normal medical store. Okay? If you want to have this machine, you need to order it from the manufacturers. You need to figure out the number of the manufacturer and then call him. Or you can buy this machine off sites like Amazon.com, etc. Right? Now, I don't really want to talk about the machine per se because Sumaya has already explained it. I want to talk to you. Okay. Now, I'm going to make 2 requests to you. Okay. My first request is, after you are done with this session, please take 5 minutes out and go to Google and type AED. And you're going to come across a few articles regarding this machine. Please read 2 or 3 articles regarding AED. My idea is to have you educate yourself. When you read those articles, you're going to understand, number one, that this machine saves lives. And the second is, if you step out of India, you're going to realize that everybody knows about this machine. Not just this machine, but also about CPR and about the laws of the land. And this machine is kept everywhere. When I say everywhere, I mean society complexes, stations, airports, gyms, clubs, sporting complexes. So a lot of places, also a lot of places where public is there. Okay, public access areas, to be precise. But it's very unfortunate that in India, we don't see this machine a lot. And here's the more surprising part. We see this machine a lot at the airports, but we don't see this machine anywhere in our railway station, right? Which is not the right thing to happen, because stations are places where a lot of footfalls happen, right? So we are working towards having the railway ministry understand this and try to get this machine everywhere. But we need your help also. If you know how to do it, please let us know. Please advise us. So my second request to you is, after you've read the articles and you've understood that this machine saves lives, please consider buying this machine, just one machine. And I'm talking individually, okay? I'm not talking like collectively. So you need to listen to this individually. And where should you put this machine? Where am I asking you to buy it for? Not for your house, but for the place that you stay in. So let's say you have a high rise, like a building. So one machine for the entire building is going to be enough. But if in Telangana, we've never been to Telangana. So I'm assuming that Telangana has individual houses. So you can form a community of, let's say, 20 houses like that, 20 individual houses, and you can collectively get the money and then buy this machine and keep it at a certain place, which would be like common to all the 20 houses. If you do this, then that would mean that you're going to make that area safe, right? It's very important. Now, why am I asking you to do this? Why am I asking you to put in money and buy this machine? Because if a person collapses, he will have just 3 minutes of time before his brain is going to get damaged. And within those 3 minutes of time, it's going to be very, very extremely difficult for a cardiac ambulance to arrive or a doctor to arrive. And in that 3 minutes of time, you have this machine handy. You can quickly, take this machine, because it's a small machine, like it's portable, and rush towards where the person is or the victim is and put the pads on. And most probably, this machine is going to save the life of that person. So, in the interest of saving lives, please consider buying this machine, just one for the entire community of 20, 30 houses. Okay. Now, having said this, I just want to make one thing very clear. We wanted you to know about this machine because you need to have knowledge about this machine. But we do not sell the machines. Okay, so in case you thought we're trying to sell the machine, we are not. Okay, so if you want to buy this machine, like I told you earlier, go to a manufacturer. You can find out the number of the manufacturer from Google, or you can buy it from Amazon.com, etc. site. Okay, all right. Sumaya?
So 2, 3 more things about this machine. This is battery operated and the battery life is for 5 years. So 5 years, there's no problem in maintaining the machine, using the machine. After 5 years, you can get the manufacturer, change the battery and continue to use the machine. And only the pads, these pads are one-time use. So if you use the pads on somebody, they need to be changed after every use. So there is one set of pads attached to the machine and an extra one in the box. So if you use the pads, you can easily change it, keep it ready for use, and get another set of pads ordered from the manufacturer. So the machine is a very long-lasting machine. Battery life is for 5 years. After 5 years, change the battery, continue to use the machine. The approximate cost of this machine is about 70,000 to a lakh. But as Anand told you, we do not need to keep this machine in our house. It is not an everyday use machine. So if you have a big society, you can have one machine, railway office, one machine, police stations, one machine, malls, colleges. If we have one machine in these places, our country will be very safe to be, and many more lives would also be saved. So this was about the machine. We've completed our 4 steps. First step, we have recognized the cardiac arrest. Second step, we have called for medical help. Third step, we've learned hands-only CPR. And fourth step, we've learned how to use the AED machine. Now, 2, 3 more important points before we show you a small video with which you'll be able to understand this even better. One, a witness fall is important. Either somebody has collapsed in front of you or somebody has said this person has just collapsed, is when you're going to go ahead and help. If 2, 3 hours have passed, there's no point in doing what you have learned today. Secondly, your safety is very important. If somebody collapses in the middle of the road, on a railway track, or near a fire hazard, electricity point, make sure you move the person to a safe place. Make sure you are safe before you help somebody else. Third thing, if somebody collapses on the bed, make sure you put the person down on the hard surface and then only do compressions so that they are effective. So let's watch this video, after which we have Dr. Akshay Mehta with us, and he's going to answer all your questions which are in the chat box. So let's watch this video first.
हम लोग उस दिन शादी में गए थे और आपको मेरी वो फ्रेंड याद है ना सुनीता, कल सेम कॉस्ट्यूम ना मुझे भी अपने लिए चाहिए। अंकल याद है आपको मैंने बोला था। अंकल 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 प्लीज हेल्प मी प्लीज प्लीज हेल्प मी।
Oh my God,
अंकल
चलो देखते
चलो,
हैं
चलो।
देखते हैं।
अंकल
मैडम क्या हुआ?
प्लीज आप एम्बुलेंस को कॉल करेंगे?
एक मिनट मैं देखता हूँ। हेलो, क्या आप ठीक हैं? हेलो, इनको कार्डियक अरेस्ट आया हुआ है। आप जाके शॉक मशीन लेकर आइए, तब तक मैं इनको हार्ट मसाज देता हूँ।
Please notice his position. Heel of the palm, center of the chest, elbow straight, pressure coming from the shoulder, and he's continuing the compressions hard and fast.
ये बॉक्स यहीं रख दीजिए और जैसे मैं कर रहा हूँ हार्ट मसाज, आप वैसे ही करिए।
So till the machine is open and pads being attached, the other person is continuing the compression, so there is no time waste. Machine is being opened, pads removed, attached as per the picture shown. Prompted a shock, press the button, and because the heart has got a shock, it has started pumping by itself. Person has come into consciousness, he started breathing. You have saved a life, such an important thing. Till then, your cardiac ambulance has arrived. Remember, he needs to go to the hospital for medical treatment, even if he has revived. And after 3 weeks of complete medication, he is now leading a normal life. Remember, 1 million deaths in our country, both young and old. And every minute you think, should I help or not, his chances of survival decrease by 10%. So please go ahead, spread the awareness, tell them, tell people, tell your family members, tell your friends how important this session is, what is the difference between cardiac arrest and heart attack, and explain to them whatever you have learned today. But whenever you're teaching somebody, please don't tell anybody, come on, lie down. I want to do CPR on you, because remember, CPR is not done on a person who is breathing. That is why a person having a heart attack, you did not do CPR. You took him to the hospital because he was telling you he's not feeling well. He was getting chest pain. But for a person who's collapsed in front of you, he's not breathing, he's not responding. He's only when you went ahead and did CPR and used the AD machine. So understand the difference, but go ahead and help. You can also save a life. Yes, Dr. Akshay, are you with us? So we can start reading the questions.
Yeah, sure. Yeah, should I'll read the questions.
Can you hear doctor clearly? Because I can't.
Doctor, your voice is a little soft. Maybe if you
Yeah.
could use
Now is it okay?
No, doctor.
slightly
It was
low.
loud
still.
earlier, but now it's not.
Oh, acha, how do I make it? Oh my God.
So, doctor, the first question is, what are the symptoms of cardiac arrest? So maybe what are the reasons we can explain, because symptoms we already explained. This was in the beginning of the session before we started. So what are the causes of cardiac arrest is what we can address to as the first question.
Now can you hear?
It's slightly on the lower side, doctor. If you have a pair of earphones, then maybe you could.
I'm trying my best. Now, no, not possible.
I think, doctor, earlier you were in your car. We could hear you very clearly. Now,
Oh,
now
acha, my house.
you go back into the car.
Okay.
Okay, doctor, maybe if you speak a little louder, it'll be fine.
Yeah, see, in almost 70% of people with cardiac arrest, the cause is the same as a heart attack. That means blockages of the arteries. So prevention of cardiac arrest will entail the same preventive efforts that will help prevent a heart attack. So 70% of cardiac arrests are due to coronary artery blockages. Okay? But there are 30% of people in whom there are no blockages, and due to certain structural abnormalities in the heart, like heart enlargement or thick vascular walls, which is called cardiomyopathy, or certain electrical abnormalities in the heart since birth. So these are the 30% will have normally looking hearts, but some abnormality which may be from birth. So these patients we cannot detect and prevent. So that is why all this exercise about treating a cardiac arrest is very important, because we cannot prevent all cardiac arrests. That is why this exercise of learning, recognizing cardiac arrest is very, very important, right? So this is about the causes of cardiac arrest. Okay.
Our next question is, what is loading dose? How to take it?
Yeah, see, we have two types of doses for certain drugs, which are especially when we talk about drugs which cause thinning of blood or antiplatelets, like aspirin and clopidogrel. In both these drugs, if you have never taken them and if you have heart attack or heart issue or angina or chest pain, then you start with the loading doses. Means the loading dose of aspirin will be 325 milligrams, the tablet that is available called Disprin, and the loading dose of clopidogrel would be 600 milligrams. So those have to be taken, right? But once you have taken the loading dose, from the next day onwards, you have to take only the maintenance dose. That's been 75 milligrams each. So loading dose is given so that the action starts faster, right?
Sumaya, you know what, doctor? It's like really, really low. Your voice is like really, really low. I wonder if people are actually able to hear you. Okay, what we're going to do, doctor? We're going to take the next question, and by that time, can you like kind of have an earphone?
Yeah, I'll
Earphone?
switch to laptop. Huh?
Yes, yes,
Yes,
please.
I think so.
Okay.
So
So while you do
Ramuji,
that, we're going to answer.
yeah.
Yeah.
Ramuji
Okay,
says,
Sumaya.
2 months back, I have a CAD, unstable angina, and now I'm taking a tablet. So Ramuji, please, if you have some discomfort, you have something, please show your doctor, your whoever doctor you're consulting, please go and consult the doctor, have your regular checkups, and continue medication as per your doctor's prescription. So please do continue that. And I request everybody else also, whoever has some diabetes, cholesterol, or any other kind of diseases, please consult a doctor and continue with your medication. Do not stop the medication without consulting your doctor. This is very important to keep your diabetes, cholesterol under control. You need to continue the medication and do not stop it without consulting your doctor. Recently, RJ of Karnataka lady died of sudden cardiac arrest. It was just 32 years. This is the unfortunate part, that it can happen to anyone, just like how Anand told you, man, woman, child, irrespective of their age, gender, fitness level, it can happen to anybody. And we are hearing this especially in the younger generation now, below 50 also, a lot of cardiac arrest. So it is very unfortunate.
Okay, he says, Esra is saying, is regular gym workouts, do they cause any further problems? Since I'm having already a heart problem and taking regular medicines. I'm 55 years of age, 2 years back I had. Okay. Dekhiye, what you can, exercises are not bad. But for you, you've already been through an event, and that's why it's very important that you take it very, very light. No heavy lifts out. I'm sure your doctor must have already told you how to go about it. But even then, even though a person may have not gone through an event like that, for a regular person also, the exercises are necessary, but they should be in moderation. So don't do exercises which are too less or too high, and never do exercises which are like immediately very high. So always do it in moderation and you're going to be okay. With you, sir, it's very important that you do the exercises, but very, very mild exercises. And any single time that you feel some kind of discomfort, please stop doing it and consult your doctor immediately. Okay. Usually, after the doctor has prescribed medicines and they've already checked you out, nothing untoward is going to happen. But why take any chance? Right?
So I think Dr. Akshay Mehta is back with us.
Russia? Okay, he's going to come.
So doctor, can we hear you now?
Yeah, sure.
Yeah, doctor,
Yeah.
much better, doctor. So I
Yeah.
think we'll have to address that once again because people didn't hear you clearly. One is
No.
what are the causes of cardiac arrest and what can we do to save ourselves from getting a cardiac arrest?
Very good. So, as I said, 70% of cardiac arrests are due to blockages of the coronary arteries or a heart attack. That means a heart attack can give rise to a cardiac arrest. Most heart attacks do not give rise to heart attack. Most heart attacks do not give rise to cardiac arrest. About 60 to 70% with heart attacks can reach the hospital and take treatment. But there are 20 to 30% who, while reaching the hospital, can collapse and get a cardiac arrest. So about 70% of cardiac arrests are due to coronary artery blockages or heart attacks. But there are 20 to 30% of people who get cardiac arrest without having blockages in their arteries, and they are due to different other causes like enlarged heart or very muscular heart, which is called cardiomyopathy, or abnormal circulation from birth in the heart, etc., etc. So there are these 30% who do not have blockages, and preventing blockages will not help in these people. So in these people, treatment is important. You have to recognize cardiac arrest as they have shown and treat the cardiac arrest when it occurs. So young people, a young person, an athlete may die of cardiac arrest due to silent blockages inside his heart in the coronary arteries, or due to other causes like a very muscular heart or certain electrical abnormalities, etc., etc. So that is the reason why different ages cardiac arrest can occur in different ages, right? Okay.
Okay.
And doctor, what can we do to prevent this?
Yes.
Yeah, so 70% of cardiac arrest can be prevented by preventing coronary artery blockages. The coronary artery blockages are due to what is known as fat deposits or atherosclerosis, and that can be prevented by a good lifestyle. Sometimes, despite lifestyle, blockages can occur. So in such people, drugs like statins, which prevent laying down of fat in the coronary arteries, so statins can help. Very rarely, sometimes aspirin can be given as a preventive, but not as a rule to everybody, and it should be only under medical guidance. The other thing I would like to say is in both heart attacks and cardiac arrest, 50% of these victims, a few hours or days or weeks before the cardiac arrest, they experience some warning sign of a discomfort in the chest or back or jaw for about few minutes, or a sudden fatigue for a few minutes. And many times it is ignored. But if it is given full attention and treated, then you may abort or prevent a heart attack or a cardiac arrest. So warning signs are also important, and you must pay attention to them.
So yes, warning signs, doctor said, keep looking for warning signs, have a healthy diet, do moderate exercise, stop smoking. This all will keep your heart healthy. Doctor, next question is, please advise, very few have got the heart on the other side. So what should we do?
Yeah, even if the heart is on the other side, our massaging is the same spot at the lower portion of the sternum, just above the soft abdomen, where the breastbone starts. So that is a spot where you do the massage. So whether the heart is on the left side or the right side, your pumping should be as shown earlier by Sumaya and Anand.
Doing bypass surgery, is there any death issue?
Every surgery, every procedure has a complication rate, which you have to discuss with your doctor, because complication rates not only depend on the procedure and the doctor, but also depend on the seriousness of the disease beforehand. For example, if you have a patient who is in shock and with a heart attack, such patients have high mortality, even if they are operated upon or on whom angioplasty is done. But if a person is otherwise having no other issues, just blockages, good lung function, good kidney function, the death issue is much less. So the death issue or the risk to life depends on multiple factors and best discussed with the doctor treating you.
During compressions, if the rib bone fracture occurs due to pressure, will it be harmful to the victim?
It'll be harmful in the sense that there'll be one benefit, that he'll be alive if possible, if you have succeeded. And after being alive, he'll complain of chest pain and remember you for many days. So there is no problem.
Yeah, no
There is no
problem.
problem.
And to add to that, the bone is going to heal, so don't worry about that.
Yeah.
Even if you think that the fracture has happened or the bone has broken, don't worry about it. You need to
Right.
continue with CPR, okay?
And
Because the
rib
focus
fractures
is
are and the rib fractures are easiest to treat because they heal on their own. You don't have to do anything else except maybe some strapping or something.
So saving the life of the person is most important.
important.
Don't bother about anything else. अपनी
Right.
तरफ से आप पूरी कोशिश कीजिए to save the life.
Right.
How much pressure should be given? How can it be decided how much pressure to give?
Yeah. I think you all have said at
We
least
have,
2
yes.
inches.
Probably this has come in before that, but you can
Yeah.
just give one recap.
Yeah.
After.
So the pressure should be so much that your hand goes down by 2 inches, and then after going that you allow the chest to recoil. So that is the way you have to give 100 beats 100 times per minute.
I will probably just add one more thing to what the doctor said. Okay, there is no body type where you decide that, okay, maybe I shouldn't be doing that much. So for example, if the person is too thin, you might think, oh my God, the person is too thin. I don't think I should be doing that. I shouldn't be going that deep. Or maybe you think that if the person is overweight, so you might think, no, I might have to go even deeper than, 5 centimeters. There is no body type where you're going to differ with the way you need to perform CPR. So for every body type, you have to do exactly that way, 100 to 120 times per minute and 5 centimeters of depth. Okay.
Yep.
So is this one-time use machine? I already explained that this machine battery life is for 5 years. Change the battery, continue using the machine. Only the pads are one-time use. Mr. Singh says, can we have the address of Holy Family Eye Care
Come
Hospital,
and
sir?
meet us. Come
आप
and meet
अगर
us.
आ रहे हो मुंबई तो जरूर हमको
आ
आके
जाओ.
मिलिए. We'll be very happy
Yeah.
to meet with you. Before CPR, we have to check his mouth or clear his mouth because some people having regular consuming of gutka or something else.
Yeah.
Doctor, do we
actually,
have to check the mouth? Yeah.
no, you don't have to check them out because what you are not doing much anything to the breathing. They let the medical team come and with their gloves and everything, they let them clean and clean the airways, maybe put an airway and all that. Because what your job is to get the blood to the brain, and that getting blood to the brain is just by compressing the chest. Because by compressing the chest, you are maintaining some circulation to the brain and keeping it alive. So your job is to keep the brain alive. And when the AED comes, give a shock to revive the heart. The airway, of course, it is good if it is open, but it is not your job to clean the mouth, etc.
What is the difference between heartache and gastric ache?
Yeah, so many times people have symptoms of acidity and burning, which could be heart attack, but which could be just acidity due to the stomach and the food pipe burning due to acidity. So many times it is very, very difficult. If in doubt, consult a doctor. But there are a few tips that I can tell you that if the acidity like thing appears or you get the symptoms of acidity early in the morning without eating anything, first thing in the morning, then it could be more a heart issue. Acidity usually is after food, especially spicy food, or at night after eating a heavy meal. So those are but in the middle of the night, you get acidity. In sleep, you have slept well at 11 o'clock and 2 o'clock, you get the sudden acidity. So that is not acidity, that is a heart issue. And thirdly, if you get acidity like symptoms when you are walking, climbing stairs, that is a heart issue. If you get acidity like symptoms which spreads to the shoulder or back, then that is a heart issue, because pure acidity due to gastric will not spread, will not increase on exercise, okay, will not come in the middle of your sleep or early morning. So this is the way to distinguish, but many times it is difficult to distinguish, and hence it is best that you have that symptom, show a doctor.
Name and cost of this machine: AED, automated external defibrillator. If you type AED on Google, you will get the full form of it. You will get more information for it. You will get the manufacturers also of it. You may not get it, as Anand said, in any medical shop, but on Amazon or on Google, you can go and search for it, and that will be available to you. Next question, doctors: can we execute the procedure on a heart operated person or any heart related problem person?
Yes, that's a good question. Yes, it can be done on anybody who has undergone heart surgery before. And because as we said, the whole thing is to give blood to the brain. And that the only way you can do it at the spot of cardiac arrest is by pumping the heart chest.
So I have again put the link of this video at the end. So what we have recorded today, you can go and watch it once again. And I'm also going to put the link of the video that we showed you right now in the chat box. So you can go, it's on YouTube, go watch the video, share the video, and you can forward it to many people, and many people's life has been saved even watching a video. So please do that as a part of this learning. What's the next question, Anand?
Doctor, he's asking, Rajneet is asking, you've told about the lifestyle, but you haven't told specifically what it should be. So what are the food habits that he can have? What is the proper healthy lifestyle he can have?
Yeah, very good question. Nowadays, we stress on food that is majorly plant-based. You can Google what is Mediterranean diet, what is a plant-based diet, because it doesn't mean it is a vegetarian or a vegan diet. Because even if you are a vegetarian, you may eat a lot of refined starch, and that may be harmful for you, or sugar, and that may be harmful. So it is not that all vegetarian foods are good. What you have to insist on is a low sugar, low fat Mediterranean diet, which consists of lots of fruits, vegetables, pulses, whole grains, nuts, and seeds. So this is the diet that is extremely beneficial for heart. And moderate, regular exercise, almost 6 to 7 times a week, every day about half an hour. In between, for 2-3 times a week, you can do some muscle strengthening. So exercise and diet are the cornerstone of prevention. And the third thing is proper rest and sleep. It is not good to sleep less and do vigorous exercise. So only after sleeping for 7-8 hours properly, sound sleep, that you should exercise. So sleep, exercise, and a proper diet, these are the cornerstones. Then, of course, reducing weight, not smoking, and reducing the stress in your life, etc. are the additional things.
And staying happy.
Yeah, stay happy.
Okay.
Thank you for your valuable feedback. We've got a lot of good feedback here in the chat box. Thank you very much for that. And also many people have said that they've attended only part of the session, or some people have missed it out. So in case you're, as I know that there are many divisions who've joined in today, different divisions. So in case your division wants to have another session, you have a large amount of people, do contact us. We will have the session again for you all, so that those who've missed it out can attend that session. Yeah, next question. Yeah.
So also with what you just said, he's saying a practical training session can also be planned for the railway employees with certificates. We'd be very, very happy to do that. We would love to do that if the pandemic is over and things are like kind of quieting down. We would love to do that for you guys.
Yes, but certificates are going to be provided to all of you all. You have to pass on your names to ma'am, and she will pass on the names to me, and certificates will be given to you all for even this session. Okay,
Girish,
what's the next question?
Girish was asking some question, but can't understand up to what age of a person can. So he left it halfway.
Okay, maybe Girish has asked because we've said it can happen to people of all ages. So Dr. Akshay, if you could address CPR for small children and for infants as well.
Oh yeah, he said it below. At what age can CPR be given? Okay, all right.
Yeah, at all ages CPR can be given. And the other thing is that for infants and children, you use your thumb for CPR. Don't use your whole hand. And in the same way, you can do CPR. And many times in children, the airway is very important, because many times it may not be cardiac arrest, it may be hypoxia or lack of oxygen. So you may have to do mouth to mouth or call the advanced medical team to help you out. Yeah.
Okay, doctor. The question is, I have heard that tablet named Sorbitret is useful during heart attacks. Is that right? If so, how to use it?
If a person has cardiac arrest, don't give any tablets. Okay. But if a patient has heart attack, that means chest pain, and you are rushing the patient to the hospital, on the way or even before going, if possible, if you have it, giving a soluble aspirin to chew and swallow is extremely important. Is the number one step that you should do while going to the hospital. The second thing is sorbitrate. Now, this can be given under the tongue in a person who has chest pain due to heart attack, but only give it if you are sure that the blood pressure is normal. If in a heart attack, if a person's blood pressure is low and you give sorbitrate, it will lower further and create problems. So if you know the blood pressure is normal or high, you can give sorbitrate. Otherwise, don't give sorbitrate, but give aspirin to all patients with heart attack if they don't have any allergy to aspirin. Most people don't have allergy, so that chewable aspirin can be given, and that makes the treatment in the hospital much more successful if you give aspirin.
Doctor, if a person has gone through a heart attack issue earlier and he's on his medication now, and is it okay for him to do workouts in a gym, and how much should he do?
Yeah, patients who already have heart attacks in the past, have been operated upon or whatever, have heart issues, these patients should have a thorough checkup done, know their limits of exercise. Many times we advise patients after a heart attack or after we do angioplasty or bypass surgery, we tell them to join a rehab course, a cardiac rehabilitation course for a month or 2 months or 3 months, where their exercise is monitored, and the counselor, the physiotherapist who supervises these exercises can tell, okay, what level you should exercise. And once that level is known, the person can then go to a gym and exercise to that level. And it is quite safe when done in this way. The most important thing is regularity, moderation in everything, exercise, diet, and everything. So then one can do this.
Right, doctor. We will not be giving individual certificates to all of you all. We'll be giving all your certificates individually to Vanita Kumarji. So if please give your names to her, she will provide me the list, and then I will be sending the e-certificates. So don't send me your name individually. Please give your names to Vanita Kumarji, and she will give me the list, and you can get the certificates from her directly. Any more questions here in the chat box? I think there is one question. Officers and supervisors work 24/7. Calls come regularly during the night. Sleep, no proper sleep, rest because of urgent emergency calls. So does this affect us? Performing more night duties. So is it a risk for them?
Oh, yes, it does affect. And hence, whatever time you get to sleep, you must utilize the time to rest and sleep and learn things like yoga and meditation, and have a stress-free, as much stress-free life as possible, right?
I think we have covered all the questions, and thank you for your feedback, data. Any more questions that you've seen we've missed out?
Yeah, just he's asked this twice. He's saying after CPR, if she's got circulation of the blood to the brain, from the heart to the brain, then how is it possible the breath can be taken if the airway is blocked?
Yes, you are right. The airway has to be cleared, but you can leave it for the medical team which comes, or the ambulance which comes. But if you can do it, maybe with a glove or a cloth, you can do it, because the best thing would be to wait. But if you can do it yourself, that is fine. Because as I said, the airway is initially not important. Later on, yes. But initially, it is your pumping that is important.
Umakanji and Moshiji, yes. Umakanji and Moshiji has raised your hand, so I've allowed you the permission to speak. If you have any question, you can unmute your mic and you can ask your question. Any questions from your? No. Okay.
There is one question which is asking, which a person is asking, sir, are the chances of cardiac arrest or heart attack less with test results such as normal for stress test or echo? Maybe the chances are less, but not nil. Even if a person has undergone a stress test and has undergone an echocardiography and these results are normal, still the person can have a heart attack or a cardiac arrest if he has a bad lifestyle, and if he has underlying disease which is moderate, like 50% blockage or 70% blockage, which cannot be detected by a treadmill test. And such a person, if that 70% becomes 100% blockage, he can get a heart attack or cardiac arrest. So when you have a normal test result, doesn't mean you are 100% safe. Okay, that is the bottom line.
Any more questions that we need to address to?
I think we are done.
I think we are done. Okay. So thank you very much. Everybody of you all took out your valuable time and joined us. I'd like to thank Dr. Akshay very much for sparing his valuable time with us and giving us so much of knowledge on this. And thank you, Vanita Kumarji, for organizing this whole thing. As I said, please give your names to her. She will send it to me and we will provide you all with e-certificates. So thank you, everybody. Stay safe, lead a healthy life, fresh fruits खाइए, leafy vegetables खाइए, थोड़ा moderate exercise कीजिए, smoking मत कीजिए, regular test कीजिए, and be safe. Thank you very much, everybody.
मेरी तरफ से भी thank you so much. Dr. Akshay, thank you so much.
Thank you.
For everybody,
Thank
Dr.
you.
Akshay is one of the most friendliest doctors we have known so far. And we always feel honored and so happy that whenever he is joining us. Thank you so much, Doctor. And
Thanks,
thank you so
Anand.
much, everybody.
Thanks, Sumaya. Always
Thank
a
you,
pleasure.
Doctor.
Always a
Thank you
pleasure.
so much
Bye-bye.
for joining us.
Bye-bye.
Bye-bye.
Thank you so much for your compliments. We enjoyed, and thank you for asking us a lot of questions. We got to know that you were listening to us. That's why you could ask all the questions. So stay happy and don't forget to wear the mask. Have a great day. Bye, everybody.
Thank you very